For the magic. All right, Modern Nurse Fest. We're back at it and we're talking about thriving and surviving in nursing school. I have two of my previous awesome students here. When I taught at a university, they were amazing nursing students, and now they're both in DNP programs. So they're going to talk about the whole kit and caboodle, the whole journey, because it's not just nursing school. They're going for their DNP now and doing a lot of cool things and coming at us from other countries. So it's cool to be a nurse practitioner, and they're going to tell us about their training and everything and some practical tips and tricks of how you can survive nursing school. And we're going to get into some realness as well, from a student side, as well as I've been a student for like 13 years in nursing. And then also as a professor when I was teaching them as well. So we'll just dive into a lot of different things in nursing school and really talk about the realness of what nursing school looks like. So if you're a nursing student, this is probably very valuable information for you. If you're a nurse, you'll probably listen, you'll be like, you'll just be like, yeah, I'm agreeing with you. Everything you said happened to me as well, because it's rampant. It doesn't matter where you go for nursing school. All nursing schools are the same. it's all the same population in one place, and they're doing all the same thing. And it affects us very similar, not just United States nurses, but international nurses as well. So let's go ahead and dive in, ladies. I'm just going to Yes, Heather. Yes. So let's go ahead and just round table here. Um, Tell us where you're at currently, and then also tell us your name, obviously, and then what you're kind of currently into. So, yes, we have Heather joining us as well. Welcome, Heather. Thank you for joining us. All right. Whoever wants to start out first.
I shall start. My name is Fabiani Cincione. I'm not going through the DNP track because I'm not insane like these two are, but they like they like the torture. But my name is Fabiani Cincione. I am currently in Atlanta, Georgia. I am in a FNP program. It's my last semester. I graduate in December. Thank Christ. I've been in school since I was 5 and I'm done for a little bit. Um, I guess a little bit about me. I come from Queens, New York. I am first generation Brazilian American. Um, and it's been a wild journey getting here. And it's so great that you have us three because we're all in the same cohort and we also know each other. We kind of like understand. We were COVID students essentially. So it was like a transition from being in this craziness to then all of a sudden now we're in nursing school and now meeting people in person and it was just it's been a process, but I'm very grateful for it. I've learned a lot about myself. I keep learning a lot about myself, and I think that's life, but it's also an opportunity. There's always an opportunity for you to grow in this space as much as it hurts, but it's a beautiful place to be in. So that's a little bit snippet about me.
Hello, everybody. So, Heather and I are coming to you live from the US Virgin Islands, and just very much still in the nursing school mindset and process. We are both doing our women's health DNP, and we also graduate with Fabiani in December. And so, yeah, we're getting our clinical hours done and very actively experiencing what nursing school is like. A little bit about me. I'm a first generation American as well, Brazilian and Lebanese. And my family currently lives in Michigan, and I moved to Georgia to go to Emory for the nursing, the pre-licensure and post-licensure women's health DNP program. So it's been a privilege and an honor to go through this very humbling experience. And I've learned a lot about myself and have gotten to meet very amazing people along the way as we've experienced a lot of challenges together.
And as Sarah mentioned, my name is Heather. I'm Heather Ahlstrom. I also am currently in the US Virgin Islands, but reside in Atlanta, Georgia. And I think sort of, let's see, pre-nursing, I lived in New England. My parents are in like the greater Boston area. And I grew up all in New England. And then right after graduation, I moved to Arizona and I was a live-in staff at a homeless shelter for women that were pregnant and parenting. And I lived in the shelter with all the women, which was quite the experience, pre-clinical. And that was during COVID, which sort of added a whole other layer to it. And then jumped right into nursing school at Emory, and have been in some form of a nursing program for the past 3 years. Very excited to graduate. Definitely have had a lot of ups and downs and challenges that come with nursing school, but very grateful for all the opportunities. Like, we're in the U.S. Virgin Islands right now, but through the NP program, I've been able to focus a lot on global health and working with vulnerable populations that have lower health literacy rates. So being able to travel to places like Mexico, Peru, Costa Rica, the U.S. Virgin Islands, and even places within the United States, just finding those pockets of people that even just a few conversations can be really impactful. And so that's kind of one of the biggest takeaways I've had from nursing school is there's a lot of challenges, but whether it's your peers, your patients, your mentors, sometimes there's just little pockets of information or short conversations that you have that can really be impactful and kind of stick with you for the rest of your life.
Heather prepped for this. You guys,
We love
You
how we
were
just
ready.
threw her in and
Lit.
she's like, I'm
She
ready.
said I had a whole spiel, guys. I've been practicing since last night. I can't.
Oh my gosh, that is so amazing. So thank you all for being here and sharing a little bit about your story. And I want to focus on I don't like the why part, but why did you end up coming into nursing? Because I know all of you have a degree already, right? Because you're all MN students. So can you just briefly just roundtable just what made you go from the degree that you got and you're like, oh, I'm just not feeling that, and then I'm gonna go into nursing. Tell us a little bit about that journey, because I think it's important that, a lot of us aren't sticking with our first degree. I know I didn't. I went into nursing. I had a public health degree, but it still was very transferable into nursing and in population health, which I love. But a lot of our previous degrees are so transferable. And so can you tell us like what your previous degree is and that kind of journey in springing into nursing?
Yeah, so
Whoever wants to go first.
oh, sorry. I was gonna go just in the order that we did. But from
Yeah.
a young age, I felt really connected to the idea of working in healthcare. My parents didn't have insurance when I was growing up. They were undocumented for a really long time. And so I was the oldest, was the translator, was everything, and just seeing that interaction with them. These are two of like the smartest human beings I know in my life, and were treated as if like less than because they had an accent or they didn't have insurance. And I just thought, I never want anybody else to feel the way that my parents are being made to feel in a moment where they're supposed to be able to be vulnerable, and their health, your health is like the most valuable thing you have. And for you not to feel like you can trust the person that you're seeing because they're making these like judgments about you, especially when I would go and see that no one looked like my parents, no one looked like my friends, my family. And so it's like, how can you possibly understand how to treat this patient population if you're like, if you have no idea who we are and how we come from. So for me, I knew that I mean, at that point, all I knew was doctor, right? Like that's all I grew up with. I mean, I didn't have anybody, I didn't have any family here that was in healthcare. I didn't know how that ecosystem worked and like who was in it and who was not. I just knew that the people that my parents saw were doctors, so that's what I'm going to do. And so I went to Syracuse University for my undergrad, upstate New York. I actually, I was pre-med, but I got my degree in psychology with a minor in art history. And I kind of realized right away that like these people weren't my tribe, if that makes any sense. Like, I'm someone that really likes to work in a team. I like to like, really just, support people around me. And it felt very just like insular and like no one wants to help each other out. Everyone just kind of wants to do their thing. And I was like, is this what it's going to be like? And so I ended up actually becoming an EMT during my undergrad, and I loved it. Like I loved the rush, loved working with the paramedics, loved like that whole thing. So I definitely considered that for a little bit, but then thought, no, Bobby, like you're already on the like on 100. You can't possibly do this as a full-time job. So when I graduated, I actually took some time to study for my MCAT, which was like the worst experience of my entire life. But I ended up working at a major hospital in New York City on the business side, and I was there for 8 years. And it honestly was the best thing I ever did because I got to learn first of all, how to be a human being in the world because I had been a student for so many, my entire life, that just like learning who I was outside of academia was really nice, but also frustrating because I kind of didn't know where I wanted to be. So then I just was like, I took the I finally, in my late 20s, decided I need to go to therapy because that's a thing that needs to happen for me. So finally got a hold on my mental health and was like, yes, medication, this is good. I need to, get my brain rewired the right way. And that was like, it changed my life, and through therapy, I was able to like take a step back and realize like you have time, like research, so I would ask like a bunch of healthcare professionals at my hospital for like coffee, or like the PA school was like the sixth floor of my building. I just show up and be like, hey, can I like sit in a class? And no one ever said no. That was like the most amazing thing. Like I had lunch with a speech language pathologist. I went everywhere. I went to radiology. I went everywhere. And it wasn't until this group of nurses that were sitting next to me at lunch once, were hearing like me talking to my friends about, oh, I still don't. They were like, whoa, 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 whoa. Have you, experienced the nursing world yet? This woman had no idea who I was. I was like, no. She's like, come, 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 and like introduced me to. I guess there was like a group of people who would work right next to me, but I never really realized they were there. But they were all nurses, and they were essentially responsible for patient experience. So like, literally, were trained doctors on how to see patients, like on a human level, which I thought was so interesting. And then they really opened my eyes. They were like, we're gonna, they had me meet like the director of quality and safety at Cornell, like, and really was just like, this is what you can do. You can do so much within nursing. It's not just bedside and blah, blah, blah. And so I really fell in love with the profession, and I fell in love with the people. I love the fact that they were just like so about it, like, yes, come to this profession, it's so important. Yes, it's what, it wasn't like, nah. Like there's a lot of people I would ask them, like, do you like your life? And they're like, no, don't do it. And so the more I shadowed, the more I learned, the more confident I felt that this was like the right choice for me. And so I applied during COVID, which was insane, but it was even more like reaffirmed. I'm like, no, I really want to do this. I want to go. And yeah, so that was kind of it was a long time. I came to nursing school in my 30s, but it was probably the best decision I ever did, was to make sure that I was at a place where I knew that this is what I wanted to do.
Yeah. Yeah, go ahead. Go ahead.
Thank you,
That's
Sharon.
amazing. Thank you for
Yeah.
sharing that. Yeah,
Loves to hear
amazing.
everybody. So cool.
Yeah, Sharon.
So I think what's so cool, which Heather and I have talked about a lot, like just on this trip by itself, is just how different everyone's journey is to get to nursing school. Because my journey looked so different from Fob's, which was like coming to nursing school straight from undergrad and not having that lived like life experience where you're not a student and you learn who you are outside of school. So I feel like first, I got my undergraduate bachelor's in science, specifically in exercise science at Central Michigan University. And my degree specifically focused on like exercise physiology, stress testing, cardiac rehab. So kind of like how we talked about on the podcast, Emily, I feel like I never really got to love that area. Like I always appreciated it, but I knew I didn't want to do cardiovascular health. I knew always that I wanted to do women's health, but I didn't know exactly how to get there. And my university didn't have a nursing program. So it was only until I realized, wow, I really want to do nursing, but there is no nursing program here, that I actually learned about accelerated master's programs. So I didn't actually know that that was an option until probably my junior year in undergrad. So once I found, like, sort of started doing my research and just looking into programs where I could do women's health, but in Michigan, there's actually a kind of a lack of educational programs surrounding women's health. There are a lot of like FNP programs in pediatrics and adult Juro, but there isn't a lot of women's health and midwifery. So that's why I started looking sort of out of state. And I knew always, like, from a young age, I wanted to do women's health. I grew up with just all women, all sisters. My mom is just like a very powerful woman in my life, and just all my female friends. And I always knew like women's health meant so much to me. And also, like, spending a lot of my childhood in Brazil, I saw a lot of homeless women who were either pregnant or had children on the street and had no access to care. So that, like, those core memories really stuck with me. So I always knew I wanted to do women's health, but sort of took that like pre-health major in undergrad to get somewhere, but didn't know what I was doing with it. So that's kind of why I didn't stick with the exercise science, but I know a lot of people do. And they'll go into like exercise physiology and do like cardiac rehab stress testing. But then a lot of people also do like their sort of pre-PA, pre-NP, pre-med. And so when I found Emory's program, I was like, oh my gosh, this is perfect. They have women's health, they have midwifery. So bye fam, I'm out. And they're like, oh, okay, she's leaving. And so, yeah, I feel like I was making those decisions like at a very young age without having a lot of life experience, but I just trusted the process and I don't regret anything about it, but definitely like we talked about in the podcast, just like a huge learning curve for myself, just like a lot of moments where I'm like, wow, I really have a lot of like just work to do surrounding my mental health and like just learning who I am as a person as I'm going through like these really pivotal changes in life. So yeah, that's sort of what my story looked like.
And
Awesome.
my
Yeah,
story is
thanks, Sarah.
actually kind of a combination of both Bob's and Sarah, because I also grew up with my mom as a first like immigrated to the United States when she was young, and she was the translator for her whole family. She was the first person to learn English, and she was the oldest daughter. And so education is not as important in the culture I came from for women. So she would get pulled out of school to go to all of the doctor's appointments and any sort of anything that the parents would need to go to. She would go to translate for banks, for figuring out an apartment, like anything, but including healthcare. And just their experience with healthcare, not speaking the language, not having health insurance, and that journey of watching her kind of lean into learning English and figuring it all out on her own, and sort of having that. I always jokingly talked about growing up, and even now more so understanding nursing. We always called my mom like a nurse that never got a degree, because she just figures out all the things that she needs to. And I feel like sometimes she knows more about nursing than I do. And I'm like, wait, hold on. But she just had that kind of a personality of like, if something needed to get done, if we needed to learn something about our health, like she would figure out a way to get there. And so that was really empowering for me. But I also didn't know anything about healthcare growing up. And we also mainly saw like MD doctors. And so I was always interested in healthcare, and my family was like, okay, I guess like you're going to go to medical school then, because that was what we knew and what we were familiar with. And so my undergrad, I actually have a Bachelor of Science in Molecular and Cell Biology. And then I have a Bachelor of Arts in Human Development and Family Sciences. And so like I wanted the social sciences and lean into that, but I also wanted the like, natural sciences, which in reflection is very interesting, because nursing is literally a combination of like the hard natural sciences and the social sciences. And that's kind of what I sought after in undergrad, but didn't even really realize that at the time. And so went in like pre-med. And then actually when I was at the shelter in Arizona working with the women, we would often be like patient advocates in a sense and go with the women to their prenatal appointments. And it was my personal experience with the places we went to with those women. There was a stark difference in how the MDs treated our clients versus how our NPs or PAs treated our clients. And so like watching somebody like be disrespectful towards somebody that's homeless and happens to not have stable housing, but is pregnant and has lots of questions and low health literacy. I actually like discovered nurse practitioners and discovered the fact that there are other people that exist in healthcare that can provide so much value and support patients. And so I was able to connect with some of them and grabbed lunch and coffee and sort of learned about through the back end of what other options were. And after sort of weighing my options, I was like, I think the holistic care and focus of what the nursing ideal is aligns a lot more with how I'm hoping to be with patients. And we need MDs for lots of reasons, but I think that there's sort of like this very organ system mindset, in my personal opinion, with MD. And I was like, yes, I want to know about the organ systems, but like for me, I want to see the human first before their organ systems. And I felt like just like the overall theory that we focus on as nurses really aligned. And so that's what sort of led me to where I am today.
Wow. Yeah. You guys, so amazing. Yeah. Thank you for sharing that. I saw Sharon's comment. It says, that's wonderful. You recognize the difference with the interactions. And I think you made a great point, Heather, in regard to the difference between doctors and nurses. When it's like the communication factor is huge, but then also seeing the patient in front of us as a human rather than a number or a room number or that patient is so commonly used in the healthcare system. So thank you for pronouncing that, because I don't think that the people in the back heard that loud enough. But hopefully they do, because, you know, you guys have such cool life experience and you've brought that into nursing. And so I think that's so valuable. And even Sarah, although you didn't work like a ton of years somewhere, you still, it's like you have this intuitiveness about where you want to go in your direction, and you just trusted that, right? So I think it's cool to showcase, like, Bob's, you took a moment and you had to find yourself. Sarah had this intuitive notion that she like knew the path she wanted to take. And Heather really was influenced by her mom, who was a nurse that never got a degree, right? But had shown her that, whatever you dream about is really possible. So like all your stories are so great. And I want all the nurses to hear this, that you are all such amazing students. And so this isn't about me, but I want to just hear some feedback of things that I might have done in your nursing school journey, when I was the time that I was with you, that has stuck with you today. Because as a professor, I think that's so important to like hear that you're like changing lives. But maybe there's something that stuck with you. Is there anything that has stuck with you that you remember from when I taught you?
Yes. And I think I tell Emily the story every time. But Emily was my health assessment professor in our smaller groups for my first semester. It was our first semester, right? In school, it was a summer. It was the first time we were in person. No, it was the second, that was fall. I don't know. I know we were in person for this. And I had just come from New York. I had a driver's license, but like, did I have, did I use that driver's license? So going to school every time we had lab or anything like that was always, I always came in with such high anxiety. And Emily, she's there so chill and grounded, and I'm like, oh, I immediately was like, oh my God, I love her energy. But what really like kind of sold it was that like every class we had, Emily would start with us like doing a stretch or doing like a small meditation, like these little small techniques. I remember coming home to my husband and being like, "Oh my God, my professor put up a whole a slide on chakras and sound healing." And I was like, "I can't believe that I'm in, this like prestigious institution and these things are being promoted, things that I care about, that I've always, gravitated towards. And there's someone right here like doing that, like that matters, like that really matters." And I think, I don't know if you know this about Emily, but everyone, like we all needed those moments. And we would like leave class, all of us like collectively, and just be like, oh my God, I'm so glad she like made us do that. Or I'm so happy to see somebody represent like this whole process in such a different way, but in a way where it feels like, oh my God, this is progress. Not that we would learn later on, not everyone obviously was like that, but it was nice to see that it existed. Emily gave me when I came really like flustered one day, and she gave me a tuning fork, and basically was like, this is what you're going to do when you're in your car every day. You put on your oil, you're going to do your tuning fork exercise. I still have my tuning fork in my car. I still use it till this day. And I will never forget that, because for me, it was just like, oh, there are people out there that think like I do. And I think that was one of my biggest fears coming into a school as prestigious as we did, was that I was going to be the psychopath there. And like that was that everyone was just like, but it was incredible. It was incredible. It was an incredible experience to have you. You honestly really cared about how we were coping. And it wasn't just like, you were like, no, like, let's do like actionable things to get you guys like centered. And to know that we had that on some level, like that's something, well, I mean, that's why we're all three of us are here right now. Like that's something I'll remember forever. And that's something I'll carry with me, because if I ever decide to teach, that's something 100% that I would do as a teacher, because I was able to see it by example. So definitely had a very amazing impact on us. So thanks, Emily.
Oh, you're welcome. I'm tearing up a little bit. Sharon said, makes me tear up. I'm like, yes, I know. I'm tearing up. Yes. Yeah. Thank you. Wow. You never know. You never know how you can affect somebody. And, those things I share with you, I hope it trickles onto your patients, because that's really what a nurse is. It's a trickling effect, right? And wow, so powerful. Thank you for that testimony. You know, it's funny when we kind of think of ourselves just really quick, like we don't really know the true impact that we leave either with patients or with students or with others until we actually have somebody tell us like how it has affected them. So thank you for that. So lovely. And I really appreciate that. And yes, the tuning fork, it works. I use one, I have one in my car. I use it all the time. Just hit it and then set it on my chest and it's like, ah. So yeah, it works. Absolutely. All right, I'm gonna drop down. Sarah and Heather, what do we
Yes.
got? What do we got?
Emily, so I was going to add to what Fabs was saying, is something that I find very both funny and awful is that like that first semester or two, I think I blacked out because like there's so much I don't remember and so much that did not stick with me. But what I do very viscerally remember was all of your emails trying to get people to go to yoga, and all of like the times I'd see you out there doing yoga, like on the grass in front of the nursing school, and me thinking to myself, I need to listen to Emily and like go to yoga. And I remember thinking, I feel like she's the only person out here trying to actually get students to take care of themselves. And like even if you didn't, because I think the class you were teaching was foundations, if I remember correctly, like it was like our foundations nursing class, or like sort of like right after health assessment or something. But I just remember like you didn't have all the students, but you still checked in with everyone. Like you were constantly checking in on people and like making sure we were good, and like really have this sort of energy to you where you're like very much trying to change the narrative for students and like making sure we're actually doing those check-ins with ourselves. And I remember you just like constantly telling everyone and like checking in on everyone, even if they weren't actually your student, which I appreciated so much because I felt like in the midst of all the chaos, I still knew you were there and like that you were offering all those things. And I think I was in like, it was such a stressful time in life that like I didn't always do it, but I was like, I need to do it. And like, thank God that there is someone here who actually promotes this stuff. Cause yeah, it's like the traditional nursing model. And I think nursing school in general, it's very, you have to go. There's so much pressure to like be perfect and do all of these things and focus on school, but you were very much like this doesn't have to be the narrative for nursing students. Nursing students can just take a second and go to yoga, and especially nursing school. And now that we've been through the NP portion, I think reflecting for myself, like the nursing school part is very high intensity, and you're just kind of like being thrown in head first. So like for you to have that sort of energy to you, that you're bringing so much light and like really checking in on people's well-being. That stood out to me just being there, you know, as a new nursing student.
Oh, yeah. Thank you. Yeah, check-ins are important, right? We should, as nurses, that's, you know, it's about changing the fundamental way that nursing school operates. And like nurses eat their young starts in nursing school. And it's very unfortunate, from the professors being bullies to the students, from staff or faculty, you know, degrading students. You know, I'm like, I can't have this culture. And this is not the culture that we should be promoting in nursing school. It starts in nursing school, even with, you know, the alcoholic celebrations. A lot of nurses unfortunately now use alcohol to disassociate because they're so stressed out and they're having burnout happen, right? So I really appreciate you focusing on how we can change the narrative, because we should be checking in on each other. I never had one faculty member ever check in on me, but I was always like, hey, like, you seem really stressed, what's going on? And they're like, oh, well, I'm in a doctorate program. And I'm like, oh, well, that makes sense, right? You know, it's, and you know, just to take a moment for that person to be like, yeah, I'm in a doctoral program, I'm really stressed. It not only helps them identify that they're currently stressed and they need to take a moment, but it also just helps to listen to somebody, right? And we should be having these exchanges consistently in nursing school, from student to student, from professor to student, or even clinical faculty, right? So thank you for making that a point. And I hope that you guys take that with you, that you should check in on each other. And I know you guys all check on each other. Because I know you guys talk all the time, right? So it's like this constant check-in of each other is just not to feel alone, and is to form a community. The people that I went to nursing school with, I'm still friends with today, and that was 14 years ago. You know, so it's like it's the trauma bonding is what it is. You know, you've been through some trauma, and we just talked about. Sarah was like, yeah, I like blacked out, you know, and that's a form of disassociation. In response to trauma, right? And trauma does start in nursing school, and it's unfortunate that it does. So that's why I started the School of Modern Nursing, because I was sick and tired of it. And in fact, that university that I used to teach for, I quit because I was tired of getting pulled into rooms and being told that I can't do meditation with students, that I can't do yoga with students, that I shouldn't be doing these things because it's not within my scope of practice. And then that's when I was like, peace. This is not a good relationship. I need to get out of here. So, you know, it's so important that we do check on each other. In a sense, not just as nurses, but as humans, right? It's so important. So, all right, Heather, I can't wait to hear what now. I'm just like, I'm so feeling so many warm fuzzies inside. So thank you. So let's keep it going here.
Well,
What do you got, Heather?
definitely want to like reinforce and re-emphasize what both Bobs and Sarah said, in terms of how you were supporting us in terms of students. And I feel like I could just reiterate everything they said, but another kind of perspective that was a really big takeaway that I had from you was how much you were teaching us like the art of nursing and seeing our patients as humans before seeing them as our, you know, whatever issue they may have had coming into whatever healthcare setting they may be finding themselves in. And one of the biggest things I remember, because I was also in the health assessment, like small group with you, and we were learning how to like, you know, put in like, do like the, oh gosh, it's escaping me what that's called when you like inserting the tube and you're putting it, yeah, NG tube insertions, or like,
Yeah.
you know, putting in a Foley or something like that. And of course, as you know, first time nursing students in a lab, we're all just like nervously shaking about the skill portion, which like is obviously a very important component. But then you were also like, okay, guys, but like you're nervous and like, yes, this is a mannequin, but like, how are you going to make your patient feel more comfortable in this scenario? Like, it's okay. You're going to learn these skills. Like, that just comes with practice. That's just a muscle memory thing. But like, what are we going to integrate into our muscle memory that's like putting the patient first? And I remember when we were doing our NG insertions, you were like, we can lower the lights. Like, ask the patient if they want to like have the lights lowered, or ask the patient like what their favorite song is, or if they want to put some music on their phone, or like maybe they don't have a support person with them right now, but maybe we can ask the patient to call somebody that makes them feel more comfortable, because eventually you'll reach a point in your nursing career. obviously I have not been doing enough NG insertions because I just forgot what they were called, but like eventually you'll be like on your 4,000th NG tube insertion, but it's going to be the patient's first time. And so like, how can we like input into our daily practice of like, these are the 5 steps I do for an NG insertion, like which of those steps is for the patient and making them feel more comfortable. And I can say through nursing school and through NP school, like I absolutely have asked patients to play music. Like if I'm doing a pelvic exam or doing something and I'm like, do you want to put some music on? Or like, I have a giant light, like we can lower the lights for the rest of the room. Or like, if you want to like take a sweatshirt and cover your eyes, if that makes you feel more comfortable. And I think, I don't know how many other professors really intentionally gave us examples. I think it's talked about a lot in the abstract of like, we need to be, you know, getting our patients more comfortable and trying to make them feel informed, and trauma-informed care are conversations that are so important to have. But I think having very like solid examples of like, okay, how can we integrate this? We can integrate this by music and by light and by sound, and like think of our senses and what senses our patient wants to decrease and which of the senses the patient wants to amplify in this moment that would make them feel more supported. And that's something I truly take with me in practice every single day. And that's something I really did learn from you almost on day one. And I'm so grateful for it.
I have to comment on that because I'm so glad Heather brought that up, because there's a story that Emily told us once that I never forgot. And it was, I think you were working at a hospital and there was like something super tragic and traumatic that happened to a patient or a patient's family member. And I remember asking you, I was like, I just don't know, like sometimes I talk too much, blah, blah, blah. Like, what do you do? Like, what do you do in those situations? And you were just like, you sit down next to them, you let them know that you're there, and that's how you offer like that nonverbal comfort. Like, and then you would always kind of start by that, but you'd always talk about how to approach a patient, but you'd always also talk about how to protect our energy as nurses, which I really appreciated. It wasn't just like serve, 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 serve. You were like, you're going into a hostile environment, you're going to have to protect your energy. That means like turning your body so things aren't like energy isn't being negative energy isn't being like thrown at you. And I just felt so connected with that because that's how I move. That's how I think. That's how I live. So to see somebody talk about that, it wasn't always just like, yes, the patient, but you're there and you have to leave afterwards, after like experiencing that. How do you compartmentalize in a way where it's healthy? And just that language in itself, like Heather was saying, like, I thought that was the norm, that was going to be like what we always talked about, but it wasn't. And people will say things in a abstract way of like, yeah, just like, patient care, patient-centered focus. What does that mean? Like Sarah and I talk about all the time. It's like there should be like a simulation of just like how people talk, like body language, like how's your face look when you're talking to a patient? Do you look judgmental? Do you look this? Do you look that? You know what I mean? Like that's not really done. So it's like, yeah, it's good to have all these skills, but the thing I learned most is that the patients I was most successful with wasn't because I did a skill so well. It was because I connected with them on a human level. I looked at them in the eyes. I sat next to them. I got to their level. These are things that and that made more of a difference than that decreased their blood pressure more than a medication did at that point. You know what I'm saying? So it's like, it's so important. Sarah and I have had endless conversations over the years about this, how we wish that there was just more, like a class just on that, like a class on just how to talk to somebody. I'm like, at this point, like improv, I don't know, like just learning how to use the words in a right way where it's not from a script and it comes from like your human self.
Yeah, I love that. That is so important. And I think I got all that communication lessons when I went through dialectical behavior therapy, like I didn't learn that in nursing. I didn't really learn how to talk to patient in nursing school. It was just through my experience through going through like my own therapies for mental health that I learned how to do DBT, which has a huge section on communication and like how to talk, how to get what you want, how to communicate with people, how to listen, right? And these are just fundamental skills that, you know, that we just don't have because we're just not taught. Like this should be taught in elementary school. You should be taught, yes, we're taught English, we're taught language arts, but we're not taught how to communicate, which is really interesting. So I think you make a really good point that, you know, seeing a person in front of you as a human. And it's funny because I was teaching this so long ago and now human-centered care is such a big thing, but it's been around all along. Somebody just put a term to it, right? And thank you for saying that not a lot of people teach that because I did feel so isolated when I was teaching, um, because a lot of people didn't support what I was teaching around me. And I think that's a really interesting point too, is to get to a place where you find people that are like-minded and doing what you want to do or speak the same language as you so you don't feel like a total crazy person. Because I did for a very long time, for like 10 years when I was in the institutional academia. You know, because just nurses aren't exposed to these kind of things. So again, that's why the School of Modern Nursing was formed. And so, yeah, thank you for sharing those. Awesome. It's just so awesome that I made such a difference in your life. And thank you. I feel so humbled and honored. And I want to cry right now because it's just so touching. So thank you so much. This is why I do what I do. All right. So let's talk about how you guys are going to spring into the future and what the future looks like for each of you, how you want to change the world. Psh, let's go.
No pressure. I have a whole notebook full of, I mean, again, Sarah is my go-to. You know, when we talk about like having mentors and stuff, I thought that that meant having mentors meant like someone older than you, who's more experienced than you. But I realized in nursing school that like my own peers were like mentors to me. Like Sarah was very much like a mentor to me. Heather is someone that I looked up to. I remember we had our maternity clinical together. She knows this. I was like fangirling on her so hard because she was probably one of the first people that I would see go out of her way to ensure that she was utilizing like the resources available to be able to like give her patients. And as a pre-licensure student who's just trying to kind of like navigate a space for someone to stop and be like, but this patient may need this, let me look this up and see what programs are available, to me was just like, yes, like that you have that mindset. So these are like things that I've taken from other students that I admire so much, as like built like in these, has built like what I kind of want to do. And I always thought to myself, like, yes, I want to be in primary care. I think primary care is so important. But I definitely see that there's a need beyond the clinical aspect. Like even just being at a clinic all day and you're just like, you see these patients for like 30 minutes or whatever the case is, and you do your best in that moment and then they just leave and they come, and it's like, how do we create a stronger impact in that world of primary care where it's not just like someone I see once a year? And for me, community, I'm Latina, community has always been the most important thing, and that's how we like thrive as, you know, as a culture. And so integrating, I think kind of coming back to the mom and pop shop of feeling of clinics, and kind of stemming away from this like massive organizational level of things, which what I thought initially, like that's how I'm going to make impact. But I really feel like healthcare is shifting and people are wanting something different. And for me, it kind of like, how do we go back to basics where, you know, like when I was growing up, everybody knew the local bodega, like we knew everybody, their whole family who worked there. It's like, how do I create that also within a community, which is on a micro level, which I used to think like to make an impact, you have to do it at a macro, and it's not. But if like someone grows up experiencing healthcare in a way, in a certain way, and then you can kind of like transmit that and recreate that in different areas. So for me, it's really much like ensuring, like I mean, I used to think about before I even went to nursing school, like having like an aromatherapy room where my patients can wait, or having like, you know, people who work with me being able to bring their kids to work if they had to. So, you know, because I was raised by a single mother, like just changing the culture of it. And having like parties where your patients come, meet each other, like actually learn about nutrition, and by like, you know, having a garden in there or something, like just having people connect with you beyond just seeing you. like once a year was important to me. And then as much as I hate it, I know that I really want to go back into academia because I think it's important for us to I think it's important for us to whip these kids into shape. No, but I think it's important to pass on what we know. I talked about Tara and I talk about this all the time, co-teaching a class like our dream, but exactly the class we were talking about of like, I don't care that you know like what cardiac disease is, blah blah blah. I want you to show me how are you going to tell this patient, what are you going to do, like I want to see you, and thinking beyond just graduating, becoming a nurse and just like fitting this mold. Like let's think like what, let's innovate within this space, and taking the time to I feel like taking the time with students to talk beyond what already exists and like what can exist, I think has been important, because that's not really supported. Because I get it, like they're, they have a system, you're trying to like make sure you pass and blah blah blah, but like I've had to take the time to on my own to like write my ideas out to make sure that like I don't stay off the path, because I don't think that I didn't come into this to go to be traditional. Like I came into this because I wanted to do something different. And so whatever that looks like, I know it's not going to probably look like what it does now. I know it's not. But I think I have enough experience and just enough knowledge in myself, I think, to know that if I want to do something, like I'm going to do it, and I'm going to find the people that are going to want to do it with me. But the thing is, I think we're in a world right now where it's more accepting of that. Like people just want something different, and it goes beyond just like it goes to like, how do we get more of us in places where we can, influence policy? How do we get more of us in places where, it's essentially like infiltrating like our whole gang in there and just like making sure that we're all on the same page of like how we can really make this the norm and not just like this like boutique thing, you know what I mean? So yeah, I have definitely, I think, for the first year of my life after I graduate, I'm going to just be like a boring person, and I can't wait to just have a routine and like be able to make plans 3 months in advance. But then after that, I'm gonna start. I'm just gonna get my rest so that I can, kind of start really thinking about what's the next step.
Nice. Awesome. Yeah. So much good stuff to come. So excited to follow along on your journey. And who knows, maybe you'll be teaching at the School of Modern Nursing. Who knows? We'll see. We'll see. All right. What about you, Sarah and Heather?
So that is such a loaded question, but just from as I reflect on that question, the first thing that comes to my mind is women's health needs a lot of work. As far as like research and like empowering women, I think that there's a lot of misinformation within women's health that I notice. And even like, I think of my little sister. My little sister, she's such a voice. She's so not afraid to say like what's on her mind and like what she's experiencing. And within the realm of women's health, she's not always had very good experiences. And when she has reached out to me just for advice or like counsel on different things she's experienced, I've always felt just like so bad, because unfortunately the way that like a lot of things we see in women's health is just like a lack of education for patients. Like we don't really do a very good job of empowering women to know their bodies and to educate women. And so like even as something like IUD insertions, and not really informing the patients of the pain that comes with IUD insertion, and not even really having a lot of resources for managing pain during the procedure, and just like a general lack of like conversation around women's health. And so kind of like twofold answer is, number one, I really as a provider want to bridge that and be someone who my patients feel comfortable just talking about anything, and also just like feeling empowered as a woman, like in that space, to know their bodies and to like feel like they can advocate for themselves. But also I want to model the importance of being a human as well. Like I think that women tend to put a lot of pressure on themselves just to be perfect, and we do a lot of like comparing ourselves with other women, and like we're just our biggest critics. And so I think that like just two things I really want to focus on are, one is just like making sure my patients feel educated and empowered to make decisions about their bodies. And two, I want them to feel just sort of have that normalization of being a human, and like it's okay that we're not perfect. Like it's okay that like things are messy sometimes. Like we just put so much pressure on ourselves as women. And then like with that, I also care so much about students, and I think like we see that the majority of nursing students are, and of course may identify differently, but maybe we're assigned female at birth, so we're our women, like traditionally speaking. And so there is a lot of pressure within nursing school, not only because it's such a high stakes profession and like you're in such a crucial role where you're providing care to people, but also because it's a lot of women comparing themselves to other women. So I just have noticed, like being as a student and being in the women's health specialty area, is that I think there's a lot of pressure on women. And so I want to be able to alleviate some of that pressure in the future for my patients, like to help them feel empowered as people, but also to just like, it's okay to not be perfect and to model that. So part of my goal when I graduate is to just be a person. And I know we talked about that on the podcast a lot. But just modeling that. I think that a lot of the times, like if you can model humility and vulnerability and just being a human, like other people sense that from you, and like they also then feel empowered to do the same. And when there's a lot of pressure in the environments you're in, you feel that like energy is contagious. Like you're feeling the energy of other people. So I think that there needs to be more spaces where just women feel normalized, like in those moments where they're like things aren't going very well and things aren't perfect. And so yeah, just that's my sort of short but long answer.
Yeah, that's awesome. Heather, what do you got?
I think the concept of not being a student in any capacity is a little bit scary. And like I did have about a year and a half off when I was at the shelter, but most of my life I have been a student, and you know, going in and continuing school, I feel like is almost like a safety mechanism of like, yes, school is really hard and challenging, but like we have our consistency and we know what our pattern is going to be. We kind of know what to expect. Like tests are hard, like all of these things, but it's like, okay, I'm learning how to study. And so the thought of the transition is definitely something that scares me a little bit, but it's also so exciting to be able to like take all of that knowledge that we've been working so hard to pack into our brain and practice. And we've been in these spaces to make mistakes and build our confidence and competencies. And now we're able to really not only share those, but really expand on them and continue to grow off of them from like our starting point, which really is like that graduation. And so I currently am a pre-licensure pharmacology. I assist teaching in pre-licensure pharmacology, and I really love working with the students. I think one of my biggest or one of my most favorite things is, of course, you're lecturing and there's like, 60 to 120 students in the class, but also being able to host the office hours and other small group, like almost tutoring sessions. I think one of the biggest things that I've learned is even if there is something not formally in curriculum, there's always a way to integrate it if you are intentional about it. And one of my favorite things is talking with students in those smaller group settings. And of course, we're talking about the content that's needed for the course, but we're also just having check-ins and talking and giving advice and peer advice. And of course, I'm happy to share. And I've recently gone through, I'm only 2 years out of being a nurse. And so I can relate very heavily with what they're experiencing in nursing school and the advice that I've had and, things I've tried that didn't work well for me. But I think creating those spaces is really something that I want to continue doing. And hopefully that will look academic for me. But then also I'll have that clinical side and be able to try different things out. For me personally, I lean towards primary care in lower income and vulnerable populations. So I most likely will work at an FQHC, which means federally qualified health center. So those are typically places where most patients are on Medicare or Medicaid. And so just finding that balance. But I think one of the coolest things about nursing is that if I think academia is something I want, I can really lean into that for a few years. But if that's not really my vibe and you want to lean back into clinical, there's so many different things you can do as a nurse, and you can really make nursing what you want it to be. And I think the more people you talk to within the world of nursing, the more you're able to kind of decide for yourself as nursing students and in the world of nursing of like where you best fit, and you can kind of bop around to different places before you find your best spot.
I think she might have frozen.
Oh, hopefully it'll be better when
Yeah,
she's
she has
back.
to go back on.
I do remember that poem.
I realize it's on my wall, and I'm like, oh my God, Emily's the one that gave us this poem.
I have this postcard or like note card that says like maybe like hero by choice, nurse by trade or something that Emily also gave us like as a card right at the end of our first semester working with her, and I also still have that.
Yeah, I still have she made us like write our names down, and everyone like put like nice comments about each other. I thought that was so cute because I played this game called the Good Things Game Sarah knows that I make when we're having a really bad day. I'm like, stop. We're gonna say 3 good things about each other.
I love that game. I love that game.
Oh, you guys, thank you. Thank you for being here today. I think there are some podcasts coming up with all three of you of just talking more about either it being communication through different cultures or just the healthcare system in general and what you guys are doing to change the world. So thank you for being here and going from surviving nursing school to thriving nursing school. So look out for these three. They're on the loose as nurse.
Oh God. Oh no.
No. Are you guys gonna go to the beach now? Thank you so much. Thank you guys for coming.
Yeah, thank you all for being here. This is so fun. We're going downtown. We
Yeah,
haven't seen the downtown area, so we were like, let's go downtown.
I love it.
Yeah.
I can
Plus
barely make
everything's
it down.
closed on Sundays, so like today's the only day we can really do that.
Yeah, I can barely make it down the stairs.
I figure.
I can't
Miss.
see my feet. I haven't seen my feet in like months.
You're so close.
So close. I didn't want to leave if without her.
Yeah.
But I know that they have a 3 o'clock one.
Hmm.
Here we go.
Yeah, because if she needs to stop the recording
I
too.
could stop it.